Okay, hi everyone. I think we're going to get started now to the webinar. My name is Jill Swartz. I am the president of Specialty Med Training, and I'm excited to bring you this webinar tonight. So it really is a part of our commitment to continuing education for our network of providers, and then some. I know a lot of the IPS folks are here as well, but we do have a commitment to constantly bring on a monthly basis information that really talks about the advancements in regenerative medicine, and we promise to always just keep it very interesting. This is a really hot topic, and we have some dynamic panelists like the ones we have tonight that are going to give you an interactive discussion format so we can really learn about the latest in the clinical protocols for cellular hair regrowth. So we have Ryan Smith, who is the Vice President of TaylorMade Pharmacy, who's going to talk about peptides. And we have Tammy Bano from PRP Science. She's the clinical director for them. And Dr. Melissa Anzalone, she's the director of clinical education for Nutrafol. So we are going to get started. There they all are. So Ryan, I'm going to let you take it away. You're going to share your insight into peptides and as it relates to hair regrowth, and we appreciate you being on the webinar.
Yeah, thanks for having me. Just as a quick introduction, for those of you who don't know, TaylorMade Pharmacy specializes in peptide products and peptide formulations, and we really had a focus in hair lately just because of all of the benefit that we think we can add. There have been several new products that we've rolled out and done an IRB study with Specialty Med Training and PRP Sciences to bring together some really good data on this area of topic, and use different tools other than the 5-alpha reductase blockers and things like minoxidil, which obviously have their limitations both from a sexual medicine side as well as a continuation and rebound hair loss side. So we've got some really unique products to talk about that sort of help us address the hair loss or this androgenic alopecia or alopecia areata in different ways. The first of which is the GHK copper. Many of you might be familiar with this product from more of a cosmetic side. In addition to its effect on hair loss, it also has a really good effect at increasing collagen, up to 70% increase in collagen when applied topically. And so another sort of additional benefit of some of this topical application for hair loss is that you're also getting some I guess, genetic manipulation, which will increase collagen and also decrease fine lines and wrinkles. In the studies, it would be better even than retinoic acid and vitamin C. And so the GHK copper is really exciting because it does a lot of things, but it also helps significantly for hair loss, especially as you compare it to minoxidil, especially the over-the-counter minoxidil. We know it's directly superior in a head-to-head study. And it sort of has many mechanisms of action because it's working due to sort of genetic manipulation. But beyond that, it also stimulates dermal fibroblasts, increases VEGF, which have some really good hair regrowth effects. And then beyond all of that, one of the biggest things is it has no rebound hair loss. So even if you stop it, you don't have this I guess, additional hair loss from just stopping therapy, which is obviously one of the major benefits. This is another thing I should say is this also helps with wound healing. Just anecdotally, there's been some studies showing that applying this to even the thighs of rats has helped with wound healing on the back of their necks, even decreasing wound healing time by over 50%. So it's an amazing product, but especially as it relates to hair. And sort of was our baseline, one of the first products that we decided to put into this study that we did with really good results. Going forward, we're actually the other product that was sort of our baseline was the zinc thymulin, another sort of metal peptide complex that, again, is naturally produced. Both the zinc thymulin and GHK are both naturally found in the body. And it's been very enlightening for a lot of things, but its effect on hair has some really good trials. One of the baselines, I think one of the handouts that you might see on the panel on the control panel includes its 6-month trial showing hair regrowth in particularly androgenic alopecia in men. So definitely take a look at that to show sort of the baseline. But again, it evolved in a lot of neuroendocrine functions, but it's effect on hair particularly remains as a result of increasing the anagen phase of the hair cycle. And again, for those of you who aren't familiar, the hair cycle has essentially 3 phases, and increasing the anagen phase is by far the longest phase. And so you retain more hair follicles and look like you have a fuller scalp. This is, again, one of the ones we really, really liked, but it does require a relatively long course. And again, I mentioned that the trial being 6 months that we referenced and is on the side, but a really good product nonetheless. The other thing I should say is that it also has the, anecdotal effect of increasing pigmentation. It might increase melanogenesis and some darkened spots on the head, but also can restore some hair follicle color as well. Not all the time, but every once in a while we will see that. And so this one, again, has been a staple of our hair protocol, and both of these so far have been applied topically.
Hey, Brian, I just wanted to add in there, you did mention about the handouts. We definitely did put handouts in there that you can reference towards the end. And then any questions that you have as you go, Ryan talks, he's pretty quick going through this, but please post them because we're going to open this up for an interactive Q&A at the end.
Definitely. Yeah, I would love to answer any questions as we go. And with each of these products, they definitely all have a different profile in terms of their mechanism of action. And so if there are any peptide-specific questions, I'd love to answer it, and we'll definitely be on the lookout for those. The third peptide we rolled out is probably, I think, one of the most exciting, and it's because it hits a different mechanism of action than we typically see in most of these hair protocols, and it still addresses the main issue with androgenic alopecia, which is DHT. But instead of worrying about 5-alpha reductase inhibition, we can actually worry about the toxic effects of the DHT and how that affects the hair follicle. So in the hair follicle, whenever you lose hair due to androgenic alopecia, a lot of it can result because you sort of stop the
Ryan, do we hear you?
me?
Oh, I don't hear him.
Ryan, we lost you for a minute.
Yeah, can you hear me now?
Yeah, we can hear you now.
Perfect. Sorry about that. But yeah, I don't know where I left off, but just essentially with the PTD DBM, it's a very, very new product. We're now even still less than 2 years old from its initial studies, but it's targeting the WNT beta-catenin pathway to rescue DHT-induced hair follicle miniaturization. So again, eliminating those toxic effects of high DHT conversion to the hair follicle. And so again, this is applied topically, and this study is one of the, again, the hallmark study that was done to show its efficacy in regrowing hair. They essentially removed the hair from mice, and then they were able to apply this and the valproic acid to see really, really potent hair regeneration. You can see the control versus some of the treatment groups in this picture. But the PTD works in combination with the valproic acid. If you're thinking about one of these peptides and their use, you almost never want to do it as a standalone product. And the reason being is they're very, very much synergistic. The PTD, what it does is it inhibits the inhibition of this pathway through its CXXC zinc finger protein, which is a negative regulator. So we sort of block that negative regulator, and I added sort of as equivalent of cutting the brakes, right? If this WNT beta-catenin pathway is the car that we want to get rolling, this cuts the brakes, and the valproic acid is the activator, which essentially is pushing on the gas pedal. So together, these work really, really well to hit that pathway and be protective against all the negative effects of DHT and DHT conversion in the scalp. And again, just going a little bit further as it relates to the valproic acid, again, whenever we do it together, we see significantly better results. And again, it shows its mechanism of action in the human dermal papilla cells by activating that pathway. Again, so always think of those as sort of a combination product or to get maximum results. Last but not least is, again, another peptide which has been talked about at length for a variety of things because it's so pleiotropic. But the thymosin beta-4 is one of the very, very first ones we saw have a tremendous benefit, but also have a tremendous benefit in conjunction with the PRP. I know that Tammy is going to be talking a little bit about PRP and the importance in some of these hair protocols. The thymosin beta-4's interaction with PRP has been, I would say, single-handedly one of the best combinations that we've seen. And And these sort of diagrams go into its effect, again, using really cool proteins like frizzled and disheveled to talk about hair growth. But again, it's targeting that beta-catenin pathway and then looking at some of the transcriptive changes it has in the genome as a result of that beta-catenin activation, which is increasing things like MMP2, which attracts stem cells, which increases proliferation, which increases survival, and increasing VEGF, which we already talked about whenever we reference the GHK to increase angiogenesis to the area, keep hair follicles alive, and retain those hair follicles. So the thymosin beta-4 has been great. And again, we already know through many, many studies that the thymosin beta-4 is expressed actually in hair follicles. This diagram definitely goes into sort of where they're found, but it also goes into some of the reasons that we see such an effect with even just the thymosin beta-4 alone. We know it increases stem cell expression of the marker K15, which helps promote differentiation and increases hair follicles. And what we see in this is we increase by far the number of follicles in the scalp whenever just even treating with thymosin beta-4 alone, or if someone has a thymosin beta-4 overexpression in their genome. So again, all of these peptide products give us just new mechanisms to target the exact same pathology that has been used with minoxidil and some of these other products. And all together have fit really, really nicely into the hair protocol and in combination with PRP and microneedling. So hopefully that gives a basic introduction. I'd love to answer any questions, especially later, and I'm sure that Tammy and I will have some references as we continue to talk about our results in the study.
Great, thank you, Ryan. All right, so next on our panel is Tammy, and Tammy she really worked very closely with Ryan doing for specialty med training, doing the hair study. So her background, I mean, she's been teaching and working with PRP for years and doing PRP just with for hair regrowth and microneedling, and then recently in the last year or so has added the peptides and some other topicals. So we're excited to have her talk because her experience in this is pretty grand. Tammy, thank you so much.
Thanks, Jill. And Ryan, great analogy of the car and gas pedal and brakes with the PTD. That I could finally understand it. No, thanks. So here we are at the age-old question of what is PRP and how much PRP is required for tissue regeneration. And the official definition of PRP is 1 million platelets per microliter in a 5 ml volume of plasma. Well, that's confusing right to start off. So, but it translates really into 1 billion platelets per ml. And it's really important that you know this because your goal is to promote angiogenesis, and it requires a minimum of 4 to 6 times baseline. So the platelet counts vary from patient to patient, anywhere from 150,000 to 350 per microliter. If the average patient has a baseline of 250,000 platelets per microliter, you need 4 times that to achieve a PRP. So a small blood draw of like 8 cc's is going to give you less than half of that. It's less than 2 times baseline. So I think the bottom line to remember is that it all depends on what you start with. If you start with a larger blood draw, you will achieve a true PRP and promote angiogenesis, bottom line. So this is actually a comparison study of different popular systems that are out there. And remember that it's 4 to 6 is 4 times is actually the minimum required. But that's not all that's really important in your PRP. Monocytes play a huge role in PRP. They are highly underrated. It's a non-inflammatory white blood cell that has a significant role in tissue regeneration. So just kind of scan those numbers, but more and more studies are really coming out about the importance of the monocyte.
And I think, Tammy, if I can interject there, I think it's really important because the physicians really need to understand. I feel that they're hindered quite regularly because where do they get this information, right? I mean, the truth is we've had this conversation over and over again and have had to deliver this kind of webinar, right? This education about not all PRP being the same and how important it is about the deliverable platelets, not just, I mean, they're getting their information from a salesperson. I feel like it's really important that they understand the numbers. It's kind of simple math and it seems so complicated, but you really do have to start with the right blood draw to be able to give the right amount of deliverable platelets that's even defined as PRP.
Exactly, and even the EMSITE system alone, which I absolutely love, even the construction of it or the insides of it, even from the tubings and from the spinning technique, it all plays a huge role in the bottom line in deliverable, viable platelets. So it just it really matters, and it's really sad because I don't sell anything. I truly give all the information and studies and let the physicians actually try and read that as best they can. But you know, we've got Eclipse out there, we've got Region out there, and they are doing a darn good job at marketing. They really are. But what are they really marketing? And I think it's really important that physicians take a moment to understand the numbers. And you cannot, it's simple math. You cannot get billions and billions of platelets unless you have a larger blood draw to begin with.
Yes, thank you.
Yeah, sure. And this is not PRP. Believe it or not, I have had physicians tell me that, oh, they get their PRP from a Vacutainer. Okay, so it's actually toxic to re-inject lab blood tubes and from Vacutainers. And there's even a warning inside every box. So the bottom line really is the more blood volume, it results in rich platelets. And you know, really, you should be thinking about the patient. I mean, if you had an option to have a blood draw from, you know, an 8 cc or a 30 cc and have, you know, higher concentration of platelets, I'll bet your option would be to have it with the higher concentration. We know PRP works. It's in every literature. PRP definitely works. So, but is it true PRP or not? Sometimes it is a placebo effect, and that's even written in literature. But you know, it's ultimately the best choice for the patient is, I'm sure, which is what you want. And so what happens is once we activate these platelets, we've got all these different growth factors, degranulation happens, and they all go to work, and they form this fibrin matrix and begins the healing and regenerative process. So we've got the epidermal, the vascular, the platelet-derived, insulin growth factors, and they all play a big role in hair regeneration. So once we get, and that's the great concentration, and we inject it into the scalp, it bathes these follicles, replenishing the cells in the bulge area that have been diminished through age and stress and inflammation and DHT, etc. And it all results in increasing blood flow, new follicles, follicular thickness. It builds integrity back to the scalp as well. So PRP works, bottom line. So it's not only even about the hair follicle, it's about the entire scalp. The first thing everybody seems to notice is their hair texture. It's thickened and their hair is shinier. So, and that happens sometimes within 2 weeks of PRP. So it's exciting. People really notice it. And it's exciting that it was also, you know, involved with the study. So.
Right. Well, thank you, Tammy. So I think we're really kind of understanding the fact that combination therapy is what we're talking about. Of course, that's what this study was about. And each therapy that we've introduced to this particular study had a specific function for, you know, the healing and regeneration of the hair follicle. So we're going to go next now into the study, and I think you and Ryan are going to take it from here and sort of explain what the study was about and sort of the results that we got, and so you can take it from there.
Okay, Ryan, I'll let you do this one.
Yeah, no, absolutely. So yeah, so with I think that some of the anecdotal experience that we had knew that we wanted to start off with definitely a base of thymosin beta-4 and PRP, and I think thanks to all the help with the specialty med training and the PRP science group, we were able to get a bunch of very consistent doctors using the same system. We use the EMSITE system for the majority of these, and then we wanted to sort of also use these other peptide products to give us, again, an additional leg up by hitting these pathways pathways, a little bit differently than most conventional pathways, so that people weren't stuck with reliance on, finasteride or minoxidil. And so we put this sort of all together with using the PRP system and microneedling as the initial procedure, and then following that up. And unlike a lot of these PRP procedures, we actually only did one application, which is, again, a little bit abnormal. And our cycle was actually pretty short, too. We only went 3 months, where sometimes a lot of these changes really go out even further from that. And so a little bit unconventional, but we were targeting, again, alopecia areata as well as the androgenic alopecia. And we had really good results with both of them. But again, those pathologies are widely different. One of the good things about the thymosin beta-4 is that it has some effect in both pathologies. It has an immune effect, which can sort of tamper down a lot of the pathology that is beyond the autoimmune disorder of alopecia areata. And then it also has all those mechanisms to increase hair, as we talked about, both for androgenic alopecia and alopecia areata. So all those sort of came together for us to yield, I think, a really, really good, consistent protocol, which had really good results, and actually in a really short amount of time. That was one of the biggest things we found in the study, was that, in a short amount of time, we actually got to see quite a bit of difference, which, again, was abnormal to some of these other just PRP standalone protocols.
That's true, Ryan. That's really true. And well into even the fourth and fifth month, we were seeing results, just more hair growth. So it was exciting.
Definitely. I think, and Tammy, I don't know if you can speak to this as well, but one of the other biggest things that I would say was sort of a detriment to the trial is just a little bit of the pain involved. Right? We continue to do a little bit of microneedling, but with I think good patient compliance, we still got, I think, really good results.
Right. That was the only.
Definitely. And again, this is just this is a slide. I definitely want to mention just the DHT shrinking of the hair follicles. Again, most people want to cut off the DHT, which again is not a bad strategy. We know it has results, but again, the number one thing we hear with finasteride is the sexual side effects, and so we just try to prevent that toxicity.
Mm-hmm. Right. And
so we just have.
Yeah.
I'm sorry. Go ahead, Tammy. I was just saying we're just kind of going through those slides as such and talking a little bit about the different effects. So go on.
No, it was just, DHT is that big culprit, right? That a lot of people with androgenic alopecia have, but it's a fine line. How do you deal with it and how do you treat it because of the sexual aspects of it? But so we know that when we inject the PRP to release the growth factors, they feed the follicles that are actually damaged by the DTH. And then we microneedle, and that improves the blood flow, kind of removes the sebum buildup of DHT and skin cells that are clogging the pores. And then, of course, the peptides.
Yeah, and Tammy, if I can jump in there too, the other thing with the microneedling is just like the valproic acid, it actually has an activation factor for that WNT beta-catenin pathway we talked about. So it's doing a couple things there, right? It's and so again, another functional, activity with a lot of benefits.
That was the cheerleading part of the study. Oh, you can do it! Remember, it's really so yeah.
Definitely. And again, in the study, we also, one thing we haven't talked about was just the numbing effect. I think we used a BLT cream, and we also allowed for ring blocks as well. But again, it's not the most pleasant experience.
Right. And I think, honestly, ring blocks would be okay. I just had a deep conversation with Dr. Peter Everett, our PhD in PRP, and he said, as long as we are not adding lidocaine to the PRP directly, we're doing okay. I mean, that just ruins the platelets, and we have no idea really just how much of the damage that it's doing. But the ring block in itself is actually safe. So then we actually could do that and then inject the scalp, and it would have no effect on the platelets.
Yeah, that's awesome to know.
Yeah, and I think we're just kind of repeating some of these slides of the peptides, Ryan, but just specific as they were used in the study and what we had found.
Yeah, exactly. And this is one of the best pictures of the zinc thymulin. Just as a standalone product, it shows again some of the effects on a particular subject after 6 months. And again, this is by increasing just that anagen phase of hair and increasing some of those MMP products, which can result in hair pigmentation. You don't necessarily see it a ton in this study, but in some of the other pictures in that same study, which is a resource on your right, you can see some of that repigmentation effect.
Yeah, and I think the GHK you sort of went through there, and this is kind of talking about more of just the combination of the thymosin beta with the PRP.
Yeah, definitely. And again, that's where we see a lot of added benefit. We do the thymosin beta 4 frequently for people experiencing musculoskeletal injuries, but they really don't ever report intense hair growth. Whereas whenever we combine that with a PRP procedure, we see that pretty frequently. So the combination of thymosin beta 4 and PRP, I would say, is definitely fundamental to the study.
Right.
Yeah, so we already kind of talked about microneedling, but it's really, really important. And this was a study that I had found. It's a reference of a secondary study proving that microneedling with the topical, even such as with our peptides, hugely improves the hair regeneration. So that, again, is why it's important that we add this.
Yeah. And in the protocol, we didn't do it with too much frequency, but we definitely did, and we used a 1 millimeter depth, which, again, is sort of the recommended depth for most of these studies.
Right. This was one of the patients from my husband's office that we did. She's in her 50s and androgenic alopecia, and just wore a wig. For years she's been wearing a wig, and so she really wanted to try this study. And she had amazing results. And right at the 90 days, you can just see the difference. I happened to be in the office when she came in, and she whipped off her wig in front of everybody and just said, "Look at my hair." So she's actually on her second round right now and just enjoying it. We were just in tears. So that was great. This is a young man, 27, who actually just had sudden onset of the alopecia areata. And so we treated it, and man, he grew back fast. It was amazing. I think within a month he had his hair back, and it started gray, but then the pigment came back. It was really exciting. Sadly enough, he's got a new spot on his forehead, but we're going to treat that in 2 weeks when he comes back into town. Knowing that it works, he's so confident. We can't cure alopecia areata, but we can certainly grow hair back. So I'm very confident about this.
Ryan, I just see a question here, if you don't mind touching on. Is there anyone that this is not for that should be using the peptides in the PRP?
Yeah, so for the majority of these things, especially most of the topicals, not really. A lot of people might get worried when they hear valproic acid with a lot of the contraindications they have there, but you're not getting very much systemic absorption. So really the only, I would say, patient population I wouldn't recommend it in are those people who have any type of cancer diagnosis or past cancer diagnosis. And the reason is that for the same reason that the thymosin beta 4 it is good at increasing VEGF and it's very, very angiogenic, we don't want to stimulate any neoplastic or neoplasm or encourage any type of metastases. And so just to be overly cautious, I would say not in a patient who has a previous cancer diagnosis.
Okay, great. And then I know, Tammy, because we definitely, train to some of the different protocols where we're just using PRP and not peptides, but in that case, the frequency is just more with the PRP. So there are some, I guess, in those cases where maybe they couldn't use the peptides, they could definitely use the protocol
We had a patient who was on prostate cancer watch even, and we just you just stay away from it. And so in that regard, then we would do 3 PRPs on him. So.
Right. Okay, great. All right. So we'll get back to at the end with Q&A. There's not any other specific questions there. So I'd like to introduce Melissa from Nutrafol. We're actually, Nutrafol is a new partner with Specialty Med. Part of what we do and what we offer for our network with providers is, vetting out the right partners and products. And we met with Nutrafol. Actually, there have been in a lot of our providers already, but this is such a perfect fit to this hair regrowth program, and that we've now are going to have it included in our 90-day protocol because it's perfectly suited. They have a 90-day program with it. So, Melissa, I'll let you take it away.
Amazing, Jill. Thank you. So really, we are a nutraceutical. Just to give you guys some background on, what we do. We are a natural hair supplement. We have 3 formulations. So we have a core for women's, a core for men, and a core for women's plus. And really based on customer feedback as well as physician feedback, we really wanted to tailor our formulations for these specific demographics. Right? We have our core for women formula, which is kind of our basic formula. And then we have our core for men, which actually has more saw palmetto in it. So obviously with more testosterone, to speak to Ryan's point there, about the DHT kind of starting that follicle, really the more testosterone you have, the more likely you are to convert to DHT. So we have that extra DHT blocker in our men's formulation. And then we're really excited about our most recent launch, our Core for Women's Plus, which really targets that demographic 45 plus-ish, really supporting, natural hormone balance as well as more DHT blockation, because after 45, you're looking at that relative androgenetic, kind of disproportion there where your androgens are actually higher than your other hormones, right? Because after you go through menopause, you're getting that decrease in estrogen as well as progesterone, so you have that relative androgen dominance at that point. So really our core formulations really effectively target various underlying causes that really compromise hair growth. And we'll go more into detail about that in a minute. And really our multi-targeted approach to hair loss really kind of sets us apart from anyone in the industry, really sets us out, or really gains us that respect in the medical field.
And I think too, if I can add, Melissa, that we're excited to be able to have this post or continuing protocol for our patients. I mean, they're asking for it and wanting it. So anything we can do, and I mean, we've learned combination therapy is what works. So to have something that's supporting them beyond the doctor's office is very valuable.
Yes, 100% agree with that. And I think, a lot of the feedback that we get from physicians as well as customers and patients is, there just isn't another product like ours out there in the market, right? They're seeing great results, they're feeling better, in addition to kind of addressing all the causes of hair loss, we have side benefits as well. So people report to us, they feel less stressed, they're able to sleep better, they just don't feel that inflammation like they used to, they're able to recover from workouts better. So we hear all these kind of anecdotal reports, but we're really excited about them because we're, not only affecting the hair, but we're having these great side benefits too, which, I mean, what kind of drug or therapy can you say has added benefits, right?
If I can interrupt, that is exactly what I'm feeling right now. So I just started the Nutrafols a few weeks ago, and I told Jill that I can't believe what I'm feeling. I'm feeling so energetic. I'm working out twice a day. I feel like mental focus is back. It was like, so this is really cool that it's working.
Camila, that is so inspiring. I love hearing stories like that because, we hear those a lot, like from our customers, from our physicians, like there's just so many positive things that come from our formulation. It's just really inspiring. And if we could go back one slide there, back to the causes there. I just want to go over that real quick. So really, we believe that internal and external factors are really affecting the hair. So you guys can see on the top there when we're talking about environmental assaults, things like toxins, styling, UV exposure, pollution, all of these things that are coming from the environment are affecting the hair. So they're actually producing reactive oxygen species, these oxidants that actually pull energy from the hair follicle cells. I like to think of reactive oxygen species as negative people in your life, right? You're there, you're talking to them, they're kind of draining you of energy, and then you may need a nap, right? Or you may need to kind of go away from them for a little bit to get your energy back. So reactive oxygen species are the same type of thing. They actually pull the energy from the hair follicle cell, and when the hair follicle cell doesn't have that energy, it can't produce the hair correctly. And then we also have here, stress. Obviously, we've all seen with telogen effluvium, the effect of stress on hair itself. We're pushing that hair into the telogen phase or into that release phase a little bit too quickly. Then we also have inflammation, which basically pushes our hair into that catagen phase, that kind of rest phase where we're not growing at all. And then to speak to the points about DHT, we have that, follicular miniaturization that's occurring when that DHT molecule, really binds to those androgen receptors. And then lastly, on the bottom here, we have the nutrition component, right? I know we talked about DHT really kind of starving the follicle, right? Not letting those ingredients really feed the follicle. So here, we're taking care of that component too with our formulation. So the nice thing about our formulation is that we address both these internal and external factors. So for the reactive oxygen species that we're getting from the outside, we have an ingredient, our tocotrienols, which is our vitamin E, a really powerful antioxidant. We have our ashwagandha, which is actually a plant helping to lower our stress hormone levels. We have our curcumin, which is our natural anti-inflammatory, really helping to promote that healthy inflammatory balance. I know we talked earlier about, monocytes being that anti-inflammatory cell. So this is a great kind of conjunction to that therapy, which we'll get in a minute. And then we have our saw palmetto, our natural DHT inhibitor, that's really helping to, prevent that conversion of testosterone to DHT. Lovely too, because the saw palmetto does not have any of the sexual side effects as most of our DHT inhibitors do. And then lastly, at the bottom here, we're providing that nutrition. So we're getting, not only vitamins and nutrients, collagen to the follicle itself, but we're actually using ingredients that push those ingredients to, more of our vascularized areas. So we have capsaicin and bioperine to really push those ingredients to more of those vascular areas, just like the scalp, or to really help in absorption, in the gut as well. So really here to play on that internal external factors, kind of theory here, we've got intrinsic factors like iron deficiency, insulin resistance, vitamin A, C, E, and D deficiency, zinc deficiency, and then extrinsic factors like we talked about, stress, alcohol, lack of sleep, all those crash diets, fat diets, high protein diets, thyroid imbalance. I like to joke that if you're a human, somehow, some way, your hair is being affected. So really integrating Nutrafol with PRP is actually the perfect combination. To play off Tammy Lynn's point, PRP has that component, that monocyte, right? That non-inflammatory cell that really helps to reduce that inflammation and really promote a healthy inflammatory balance. We have ingredients in our formulations like the curcumin, a natural anti-inflammatory that really helps to promote that as well. So we're seeing a lot of synergy between our formulation and the PRP treatment. And just like the PRP therapy, helps to promote, VEGF and really promote that delivery of nutrients, to the hair follicle itself. We're seeing that too with our ingredients. We have a capsaicin, which is a red pepper extract, and a bioperine, which is a black pepper extract. And both of these ingredients are promoting delivery of nutrients to the follicle itself, as with our hyaluronic acid and our collagen also doing these features. So we have some great case studies here to show. We have a woman here on the top. These are 4-month photos for PRP treatments and Nutrafol. So you can see there on the left-hand side, she's actually a female pattern hair loss case, more of that androgenic alopecia. And you can see, after 4 months, how much that part really tightened up. And she just really started to see that fill in on the top of her head. On the bottom here, this patient, she is 4 months into PRP and Nutrafol, and you can just really see that increase in density, especially around the hairline. She just saw, a really huge increase in growth, kind of where her forehead meets her hairline there. And then not to forget our men here, we're combining PRP with Nutrafol here. You can see that gentleman on the top there, just a real androgenic pattern there, the loss of the crown of his head. And you can see some great results after only 4 months on both Nutrafol and PRP. And then the gentleman on the bottom here, he's an interesting case because he saw a real increase in density of his hair. and he reported just an increase in pigment as well, which we thought was an interesting side benefit of Nutrafol. He actually saw his hair get darker, which we've heard from a couple of customers that, Nutrafol may be working in that antioxidant way to, prevent the degradation of the hair pigment itself, but really interesting to see, especially in these photographs of before and afters.
And Ryan, isn't there a peptide that is doing that as well, having an effect on the color of the hair? Can't remember.
Yeah, definitely. That would
Exactly.
be the zinc thyme. It helps with that melanogenesis. Thymosin beta 4 also might have an effect.
Right. Okay, so Melissa, did you have anything else?
No, I think that's everything. Thank you.
Okay, no, thank you. Awesome. All right, so I think we're coming close to our Q&A, and just we're sort of recapping that we all understand and kind of agree that combination therapy is really the key here. So putting, PRP, for all the reasons we discussed, being able to replenish the growth factors and stimulate the dormant hair follicles, and peptides are promoting the new follicles, and now, new nutraceuticals helping us take it really a step further. Shampoos, I'm going to briefly talk about a upcoming product that we have been doing a study with. It's out of South America, a couple studies with them, and we're going to be excited about bringing that on. So just to really recap, this is part of what the protocol was for the PRP and peptides, P2 being the two Ps, and this is just something that we've put together. Tammy actually can train to this, doctors who are looking to learn how to incorporate these protocols. They're pretty basic, but I mean, she can come in, and as far as doing the microneedling and the injections and how it's actually done, we've kind of put it all together in a kit, so it makes it easy for the doctor to prescribe it, if you will, to the patient. It includes the PRP kits and the Nutrafol, and a quick reference guide for the patient to take home and follow for the 90 days, the 90-day supply of the Nutrafol, the microneedling roller, and whatnot. And then we have same thing for women and men. We offer as part of that the suggested price and timing of doing it and packaging it all together in a kit. This is all stuff we can discuss afterwards, and if you have questions about. This is the product that I'm talking about, Abeona. It's a shampoo, conditioner, and a capillary serum. Like I said, this is a natural product that's coming out of Brazil and the Amazons. It's being tested. Anvisa is like the FDA of the US, probably even a little stricter when it comes to cosmeceuticals. We have two studies. I'd actually have them as handouts. They're not translated yet from Portuguese to English, but as soon as those are ready, we'll make sure they're available to everyone who is registered. And this is some preliminary results of this study by Anvisa. This was with 20 patients. This is showing some of the before and after. Really, the results from both the independent study and the Anvisa one was with 20 patients. The independent study was with 33 patients, but in all cases, the results are showing new hair growth in every participant, as well as follicular thickness, healthier scalp, and also calming of some inflammatory responses like psoriasis. So we're kind of excited about this. I just didn't want to lose the opportunity or not take advantage of the opportunity of having such a large audience when we're talking about hair, as to not say this. We're not really ready to launch this. It's just, it's not even available yet in Brazil, but within the next 60 to 90 days, we'll be having it here in the US and being able to roll it out. So we're kind of excited, and we're going to get it to our network first. So that just leads me to some questions and answers, and we have a couple posted, and one is it relates to peptides. So Ryan, this is for you, about what is the frequency and dose of the specific peptides? Is it all topicals? I mean, we can answer that, and we can talk about protocols, but just general, if you want to generally answer to that.
Yeah, sure. I won't go into depth a lot, but additionally, the only injectable is going to be the thymosin beta-4, and we recommend that generally at 750 micrograms every day for 20 days. In the study, we actually did 10 days on, 10 days off, and then repeated it. And beyond that, most of the others are just topicals once daily. And the study, we only did the PTD, valproic acid, once weekly. But I think that, again, that one being one of the most effective products, if we had to do it again, we might change. So, again, most of these are topicals except for the thymosin beta-4.
Okay, great. And we actually don't have any more questions, so I hope that means we were very, very thorough for this large audience. But I do have this this slide up here just to show, if you're interested in learning more just about the kit itself and just all the components of the protocol, that can be found at PRP Science. You can contact Tammy directly to learn more about just training or more details on the protocol. She actually will go to practices. She's going to one Monday. She'll train the clinicians or the staff and actually do procedures on the patient so you can see it. And then Marissa, I believe they're giving a particular discount to anyone who is part of this specialty med network or even the IPS, anyone who participated in this particular webinar for the nutraceutical product. I mean, less than you could get it from them themselves. And then TaylorMade, I guess if you don't, I think everyone might have an account with TaylorMade, but just in case you don't or are new to peptides, Ryan is awesome and available, and you can click on the link. And who is that? Oh, and then I also have someone on the call, so this is great. We can actually, I don't know how we can unmute her. We will. So another clinician is on this webinar, which I didn't even know, but she participated in her practice and she had 12 patients in the study. So she is on the call. So please, Elizabeth, if you'd like to, can you hear me?
Hi, can you hear me? Yes.
Yeah. We can end with that. That would be great.
Hi, Ryan. Hi, Tammy. Hi, Jill. Hi, everyone. Welcome. So I involved a lot of my patients in this study, and I just wanted to let everyone know how happy all my patients are with the results. Some of them not as fast as others, but even still, they all noticed some changes. And because this is a regenerative process, I was very clear with all of them that they had to be patient and that we're not just trying to do a quick fix here. We're trying to, heal the whole problem and regenerate from scratch. So I am putting together all my final pictures so I can send you guys my before and afters. But I've had nothing but happy patients and great results.
Great.
Yeah, thank you for sharing too. And I'm excited that even to get those particular patients and all on this Nutrafol, so we can really keep it going.
Is to now kind of take another set of pictures, get them on Nutrafol, and see where we go from there. So I'm excited about that too.
Great. Well, thank you for sharing. Well, if that's it, I don't think we have any more questions. Ryan, thank you very much as always for helping educate all of the participants. Melissa, thank you to you, and Tammy, all of you. I really appreciate your time and really helping me continue. I want you to know that the conversation will be continued on the IPS. If you're not a member of the IPS, check them out at the peptidesociety.org. But the other questions can be posted on there, and the discussion will be in the forum titled, just the title of the webinar, Recover Your Roots. So with that said, I just want to thank you all again. Have a wonderful evening.
Thanks, Jill.
Thanks, Jill.
You're welcome. Bye-bye. You're welcome. Thank you. Bye-bye.